BioBalance Healthcast, episode 246, Why Doctors Use Off-Label Drugs.
BioBalance Healthcast features conversations about positive aging. Your hosts are Dr. Kathy Maupin, Medical Director of BioBalance Health and a leading expert in treating symptoms of aging, and Brett Newcomb, a licensed professional counselor.
This week we're going to talk about three drugs, primarily, drugs that matter for many of the people who regularly follow our podcast and read our information on the web. The drugs are metformin, Arimidex, and finasteride. And a lot of people that have the concerns that Kathy treats in her practice are taking one or more of these drugs. And we want to talk about why that is, what those things do, and what side effects might be involved for basically three conceptual points. We want to talk about drugs that are classified as off-label use. We want to talk about the importance, and this is so incredibly important, and it's so screwed up by so many people, of following the directions the doctor gives you and taking the medicines the way you're supposed to take them. So many people play with their medicines. They double up today because they missed yesterday, or they don't take it in the morning and they take it at night, or they decide that they read something on the internet, or they drove past the mailman and stopped and he said he talked to the milkman whose wife takes, and they decide, oh, that sounds good, and they stop doing what they're asked to do to get better.
It's called a treatment plan for a reason.
And then the final thing is
the doctor's.
To factor in any medicine in terms of overall balancing of goals medically. What are you trying to accomplish? How do these things play together? You know, do they play well with friends, or will there be complications? So we want to talk about these three drugs in response to those three categories. So let's start with the first drug and talk about metformin.
Metformin is a medication that is FDA approved for diabetes. And what it does is, you have to understand how it works. It actually makes people's cells insulin sensitive, which we've talked about before, which means that insulin carries blood sugar into the cell. Okay? So insulin has to, it's like the piggyback so the sugar can get in. If the cell's not sensitive, it bounces off and makes fat.